Hi, I welcome you on behalf of Aries exams team to the MRCPI OB/GYN for the exam scheduled in November 2019. You can enter this exam if you have passed Part 2 written. For complete details, please visit the RCPI website. Application dates for the MRCPI OSCE for November 2019. Please note here that candidates unsuccessful in getting placed must reapply again online. The online application forms were made available on the RCPI website on 28th of August to apply online. Booking will be an application only with no fee attachment so as to register your interest to sit the exam. Successful candidates will be contacted after closing date of 25th of September 2019 to complete the payment then. Candidates can choose to book to sit in Ireland or UAE, not both places. Places in this exam are limited and RCPI says it cannot guarantee a place to any candidate. Applying for the exam. The next MRCPI OB/GYN OSCE exam will take place on 22nd of November 2019 in Dublin and Galway, Ireland, on 22nd and 23rd November in Abu Dhabi, UAE. Applications were opened for Ireland and UAE on Wednesday 28th of August and will close on Wednesday 25th of September 2019. So here is a screenshot of the MRCPI website. You can visit the link for complete details. The link is, as you can see, the cursor moving on it. If you previously were unsuccessful in getting a place, you must reapply again by completing the online booking when it is open, as no application or fee is held. 2019 MRCPI OB calendar available here. As you can see, you can download that for more details. For application fee, visa requirements and other details, please visit RCPI website. The link is shown here. Now we come to the OB/GYN OSCE guidelines syllabus. It is same as for the written exam. How to prepare? It is important to prepare for the exams and not underestimate how long it takes to get ready to sit your exam. Having an understanding of how each exam is formatted and how questions are constructed will help you prepare and develop good answering strategies. When you are preparing your study plan, make sure to refer to the curriculum for basic specialist training in OB/GYN, as the MRCPI in OB/GYN is based on this curriculum. It serves as a blueprint for the exam. So the basic specialist training curriculum link is given here, and it is like this on the RCPI website, so you can go there and download it. The format of the MRCPI Part 2 OB/GYN OSCE exam. OSCE format. Page 11 of the link on the RCPI website. The objective structured clinical examination consists of 7 active stations, each of 10 minutes duration, including interactive stations. There is a 2-minute rest period in between each station. This examination tests factual knowledge and the understanding, problem-solving skills, diagnosis, investigation, treatment, clinical skills, and communication skills. The clinical examination consists of the presentation and discussion of one long clinical case in either obstetrics or gynecology. Each candidate is allowed 25 minutes to examine a patient before discussing with two examiners for a further 20 minutes. A pass in OSCE clinical examination is mandatory and is achieved by satisfying the following conditions. Obtain the minimum pass marks for skills which have been preset. Obtain the overall minimum pass mark which is determined by the board after a thorough data analysis which takes into account both the difficulty of the examination stations and the overall performance of the candidates taking the exam. Pass a minimum number of stations required. Pass clinical. Non-adherence to WHO hand hygiene standards will result in an automatic fail in the clinical examination. Usually 3 stations are based on gynecology, 3 on obstetrics. 1 station will involve communication with a role player. 1 station will test your clinical skills and you will be asked to interpret results, reports, identify an instrument and its uses, describe a surgical procedure and its complications, how to obtain a valid consent, or clinical governance concepts can be tested. Sample OSCE circuit stations can be like this. Station 1. Time 10 minutes. You have 2 minutes to review the history of this case. On hearing the buzzer, enter the cubicle, answer the questions for the examiner. Question: 35-year-old Gravida 3 Para 2 with 26 weeks pregnancy with suspected IUGR has been referred to your clinic. A. How will you diagnose it? B. How it will change your management? C. How you will plan her delivery? Please remember, 2 minutes outside the cubicle are very important. Ensure that you have understood the questions well. Make your answer plan. Stick to your plan. Enter cubicle on hearing the buzzer. Say hi. Examiner will ask you, have you read the case scenario? Then examiner will start asking the questions. Be calm and composed during this discussion. The suggested answer template to the question could be like this. You should diagnose a primary breech at 28 weeks in preterm labor. Survival rate at this gestation is 80%. Keep membranes intact. Give antenatal corticosteroids as they will reduce the risk of respiratory distress syndrome, necrotizing enterocolitis, and intraventricular hemorrhage. Give magnesium sulfate for neuroprotection. Give tocolytics to delay delivery until steroids have their effect. Do clinical assessment of mother and fetus. I will inform consultant on call and NICU about this patient. I will ensure availability of neonatal bed in my hospital. In case of non-availability, I will make appropriate referral to another maternity and neonatal hospital. Explain current situation to the mother, that high likelihood of progress towards delivery, 10% risk of serious handicap. Discuss options for delivery. Counsel the patient that both modes are equally good. No evidence that cesarean section will improve perinatal outcome. Cesarean section would increase maternal morbidity and mortality, risk increase for future pregnancy, increased risk of RDS and hypoxic ischemic encephalopathy for fetus. If labor progresses, vaginal delivery can occur. Least risk to mother, both short and long term. There is risk of fetal head entrapment by cervix. I will ask mother about her views and wishes. I will give her time for decision making. I will document everything in her notes. After this, the examiner can ask you some additional questions at this stage. Station 2, obstetric cholestasis. Station 3, mitral stenosis. Station 4, laparoscopic procedures. Station 5, endometrial polyp. Station 6, role player with secondary infertility. Station 7, intrapartum investigations, lab results, radiology reports, identify instruments, or describe a procedure. Long case. Note: this is the most important part of your exam, as it forms the basis of your success in the exam. If you fail it, you will fail OSCE also. After finishing 7 short cases, the candidate is required to go to the assigned hospital for the long case. After identity check, you will be taken to patient room with 2 A4 size blank papers and a pencil for history taking. You can take your stethoscope, hammer, measuring tape, and a torch with you. The RCPI has introduced some changes for the OSCE from November 2019. You can visit the RCPI website on this link to see the details. The key changes to note are: the clinical case is now fully observed. The clinical case will now be 25 minutes in total by the bedside. The revised format allows for a much greater level of communication between candidates, the patient, and the examiners. And face-to-face examining time has increased. Please remember, there is no change to the OSCE component at this time. The long case. You have 25 minutes to A. Take appropriate history. Very important to take a detailed history in limited time. Practice following a suitable template to avoid missing any vital information. B. Perform examination. Please remember, intimate examination is not allowed. Expect to perform 2 to 3 tasks like how to check fundal level, anemia, etc. etc. The examiner will observe you while you are taking history from your patient and performing any examination. Your communication and counseling skills are assessed. Examiner will ask you 10 to 12 questions on the same case or some different topics. Then, examiner will ask you to leave. With this, your OSCE is completed. Candidates who fail the OSCE clinical examination must retake this component of the examination. Candidates will be notified of their result by email only. In no circumstances will the result be given by telephone. Examination results will be published within 4 weeks of the examination. How ARIES exam online courses for MRCPI OSCE November 2000 can help you. Well, ARIES exam has 85% success rate. We have one long course which is starting from 28th of September 2019 to 17th of November 2019. Classes will be on Saturday and Sunday, 3 hours per session per day. The features of the long course. It is a comprehensive course. All modules covered with relevant short and long cases. 70 most frequently tested short cases are covered. 10 to 12 all possible long cases are covered. Hot topics, important guidelines, and patient information leaflets are also discussed. 2 mock exams are included. Instant feedback is given. The course is highly interactive, plus access to recorded sessions till November 2019 exam day will also be available. The fee for the long course is 500 British pounds. We have, that is, the ARIES exam has 2 short courses for the MRCPI OSCE November 2019. Again, our excellent team has 85% success rate. The first short course is a 3-day intensive course from 18th to 20th of October 2019. The second 3-day final revision course is from 8th of November to 10th of November 2019. The features of the short courses are intensive preparation for 8 hours a day for 3 days, highly interactive, 40 short cases will be done, 10 long cases will be covered in detail. Important topics like clinical governance, biostatistics, consents, lab results, radiology, images, surgical procedures and instruments will be covered. Instant feedback will be provided. Access to recorded sessions till the exam day will be available. The fee for The short course is 295 British pounds. For details, please contact ariesmrcog@gmail.com or the Facebook Aries Exams. Thank you very much. Best of luck for your exam. Finally, since the seats on the OSCE are very limited, so in this case, Aries Exams can tremendously help you in passing the exam in the first attempt and in turn save your precious time and help you join your new job with your new qualification. Once again, thank you very much for attending the orientation session of Aries team for MRCOG OB-GYN OSCE for November 2019 exam. Best of luck for your exam, please.